It is my pleasure to introduce a healthcare colleague, well, not healthcare colleague, a healthcare professional colleague and friend, Kathy Crystal. Kathy is an innovator in the healthcare space. She is a courageous healthcare provider who followed her passions and goals to envision, implement, and transform the approach to care for the geriatric population within a big healthcare system. Dr. Crystal will share her experiences of developing the idea, putting the pen to paper, and gaining support and approval from leadership to begin a robust geriatric program in an inpatient setting. The story is a great story, and the model of thinking big and thinking small and using care as a blanket over all of it is fantastic. Kathy, thank you so much for joining us, and we look forward to learning from you what it's like to be a courageous leader in the healthcare space. It's all yours.
Thank you very much, Kelly, and I'm very excited to be here presenting tonight. This is a topic that I have such great passion for, and I'm so happy to share. Being a healthcare innovator, I've worked in the healthcare system for over 20 years, so started before I was even 20, and really found some great passion in how I wanted to provide care, especially for the older adult population. So if you hear me say older adult or geriatric, I'm referring to patients who are 65 years and older. But I worked in a healthcare system with thousands of employees. So how as me as one provider can I impact and make such a big change? I often really felt like a small fish in a big pond. And I also was enrolling in this new program as a new nurse practitioner. So how did I get the support to even start a program like this, but to also start a program like this as a new healthcare nurse practitioner? So we can go on to the next slide. First of all, I just like to start. I have no disclosures other than the fact that I love what I'm talking about today. And will continue to want to share my knowledge and answer any questions from any of you today or in the future. All right, next slide. All right, so the objectives, what I really will be talking about today is really how I found my passion and my goal for what led me to developing a whole new program within a big healthcare system, and really how to establish that idea, not just tell the story, but really put pen to paper to move forward this idea, to collaborate with key stakeholders that needed to be involved in this healthcare system. How do we find the key people that need to be there to help support me when developing this program so I can get it up and running and have it successful and sustain and grow? But also throughout developing this program, the things that I really focused on within myself were really being courageous, being persistent. I got that from a lot of people that my persistencies really paid off, but being receptive. But also, it was really important as I was pushing out different parts of the program or pieces or projects of really being reflective so that I knew that this would turn out to be successful along the way, knowing there would be bumps in the road, but we would get there. So overall, really, I didn't want to just talk, but I wanted to make the walk happen, open the door, really tell the story and take actions. And I'm going to walk you through how I did that. Next slide, please. So really my passion and goals started out really young. When I was just beginning working in the hospital system, I started working on an adult geriatric floor, which were patients 65 years and older. And I found my passion was this population I wanted to take care of. And I wanted to know more about them, how to take care of them better, how were we taking care of them. But again, in my early career, taking care of them, I had a lot to learn. But my passion, my goal really led to these ideas of what can we do to continue to take these next steps to hit the bullseye with developing this program to make something that drives change and also improves care and outcomes for these patients. But really setting goals at each step that I took. Sometimes it felt like I took a step and I had to fall back just a little bit to reset that goal and go forward, but really knowing that I could get back up. But there was a lot of planning, my passion, really getting that out there. And sometimes this felt like the most time consuming step was getting that passion and goal and idea down on pen and paper and making it really a realistic goal that could be obtainable within this system. But really also making sure I had the confidence to do that. So, really doing a lot of research and reading and learning and becoming an expert in the area of what does taking care of the older adult mean. And then really allowing myself to immerse myself in uncertainty and asking the questions, but and empowering and motivating those around me, which I'll talk about more, is, a lot of people in the healthcare world find their passion, whether it's taking care of the child, the middle-aged, somebody who's pregnant, or the older adult, but not a lot follow that passion of wanting to take care of the older population. So how do we get them to get there, even though we know it's not their passion? And lead to that idea, but gain respect along the way, and really along that, really remain to who I am as myself, knowing that I love to take care of this population. And I'm not going to let anybody steer me from that. There may be hiccups along the way, but we're definitely going to get there. But again, sometimes this step, the planning idea, took me probably about 3 years as I was working on my doctorate in different projects within this patient population, to what this really looked like from day one when I started to the third year when I started to actually getting this program approved and up and running. So this felt like the longest part of the whole step, but well worth it, knowing that my passion and my goal. And I was often identified as the geriatric lady, which you can see I'm not 65 years or older, but everybody knew how much I cared for this population, the expertise I had caring for this population. And again, trusting me as I moved forward. So next slide, please. So really the big idea was really the next step. Again, like I said, following that passion, that goal, but really putting it down to pen or paper. Things like this, the big idea can be a small idea in a big business like what I had, or it could be a big idea for a small business. But really writing it down to make sure if it's a big business, small business, is it going to work for that type of business? And reading it over to yourself. Like I would write down my goals, my ideas, my plans on paper over and over. I probably had so many notebooks going, but then asking myself questions over and over as I wrote down the ideas to really figure out, how can I make this happen? What is the exact population I'm going to touch as a provider myself, knowing I was going to be the only nurse practitioner. I couldn't take care of too many patients at one time, but how was I going to make that focus and plan to be successful, to be a well-known program, that is also going to continue to grow. But also when it comes to ideas, we can't only think about, especially in healthcare as a provider, I not only thought about providing good care that patients and families would be happy about, but also that my partners, or other disciplines that I collaborated with, whether it was trauma surgeons, neurosurgeons, orthopedic surgeons, that they would also want this program, want my care that I provided to their patients. But also there's always that business side of it and the revenue side of it. So also working with billing and coding and trying to learn, okay, what can I do to not only have patient satisfaction scores, good collaboration with my partners, but having a business, a system that really grew in the green, because we know no business can be successful or no program can be successful if we're in the red. So how can we not only, I don't like to put it this way, but make money as a program to continue to support the provider salary and also improve outcomes. Another thing is looking at data such as decreasing hospital length of stay, decreasing readmissions to the hospital, or even aligning wishes for patients' care. Oftentimes patients are older, pretty ill. So do they want to go to surgery? Do they even want to be admitted to the hospital? So really looking at the key big idea of how this could work. And for me in this big business, this big hospital, I really had to sort out not only just the patient and family and making them happy and wanting my care, but all the partners I worked with within the hospital, but also having good outcomes and improving data such as hospital length of stay and hospital readmissions, but also making sure that we're staying in the green positively for revenue. So really putting that all down to pen and paper. As you can see that little guy in the corner there, that's hands on his head. That's what I felt like in the beginning. And I kept having to ask the questions. I had this big old grand idea, but I really had to separate it out to make sure that I was asking the right questions for each area to make this successful, that so that we can move forward with starting this program and growing it. All right, next slide. And key stakeholders are one of the biggest piece, I think, with this, because I could never do this alone, but I really had to figure out who else really cares about the older population that I can grab in and latch on to my passion for this patient population, but also who doesn't care or have as much passion that I could get them to get on the same page as me, and how to collaborate together. Because we know when you put a puzzle together, if you're missing a piece, it's not going to work. Or you got a wrong piece, it's just not going to work. Especially in a big system from top to bottom, I really had to make sure I had all the key stakeholders to get the support that I needed. And I was very fortunate that I had two leaders above me who really saw my drive and passion for the older adult population, especially those with traumatic injury, who supported me along the way and had my back and knocked on those doors with me. But I really got them to identify my passion and my goals, and it got them just as excited. And then it just, the team that continued to support me just grew and grew and grew. For example, I have many nurses I've worked with who, taking care of a geriatric patient wasn't their favorite. But once I was involved caring for them and telling them the importance and the different type of care we need to give to them, I could hear them lecturing nursing students in the hallways about geriatric patients and sharing that knowledge and passion. And also, I've worked with residents, physicians who had no passion at all for the older population. But once I've worked with them and through their year of training, have actually said, I really enjoy this and this is going to impact me to provide better care. They may not be specializing in geriatrics, but they're most definitely going to have their hands on caring for some of the older adult population in whatever specialty they go into. So that they just felt more comfortable with that then. So again, really getting that support, that's key stakeholders from the top to bottom within the system you're in. I had nurses, I had co-partners, nurse practitioners, my upline, all the way to the top of the hospital, the CEO, really supporting and allowing this program to happen. Next steps. Next slide, sorry. And again, being courageous. I will say that this one was hard for me, especially in the early years of my healthcare career, because I'm truly more of a quiet person. I would go to a meeting, I would want to just sit in the corner, take notes, and soak up all the information. But I had so many big ideas popping in my head. I felt like I always walked into those meetings on my tiptoes, quietly, and then walked out on my tiptoes. But really just started realizing I have some good ideas. I can really lead these ideas and make some good results and outcomes to follow my passion and goals and get to that vision. And I dug my heels down and walked through that door, really broke through those obstacles to be brave and speak up and really push myself, outside that comfort zone. And it was a little nerve-wracking at first because I've gone across the country presenting about the older adult population with traumatic injury. I never thought I'd be sitting at a podium in front of thousands of people and be able to ever speak. I thought it would freeze, but I had been able to do that. But the thing that really always helped me was I knew this was my passion, and I had such great knowledge and became an expert in this field that it felt good to share that and to be able to answer people's questions about it. But it's really along the way for me, being courageous was, again, just not being afraid to say yes. Maybe I wasn't exact expertise on the certain topic we were trying to move forward with, but really learning it and then learning to do it And that's what happened. My day one, when I was a brand new nurse practitioner and I started the program and was going to see my first patient, I really thought, okay, I'm doing this. How am I going to do this? What's my first day going to look like? How am I going to provide care to this patient population that's different than what they're already getting in the hospital to make an impact? Because we know they have medicine doctors in the hospital, but I'm a geriatric provider. I wanted to provide different care. We know we have palliative care services. I wanted to provide that care with my geriatric patients as well. And overall, it really did got a lot of recognition to where there's been many disciplines and services throughout the hospital who are begging to have this service within their own service, because they're very pleased of the outcomes, the care we provide, the continuity of care, and patients and families have been just super happy with it. So I'm really happy that being courageous and getting out of my box, my comfort zone, has helped to push me there. Because if I didn't, I would never be where I'm at right now to be able to share with you or have all the other providers that were able to be hired within my group to work with me and to continue to expand and grow this knowledge and share this knowledge, not only to healthcare providers within our own system, but have had healthcare systems across the state and country reach out to figure out, how did I develop this program? What am I doing? And they want to replicate it because it's so successful in improving care for this patient population. Next slide, please. And being persistent along the way and continue to knock on the door is something I was really, once I gained that courage, got through my shyness, I was pretty known for, in knocking on several different doors and always willing to just ask the question, take the risk. I continue to just water the plant. What I always said was I was infecting everyone's ear with knowledge about the geriatric population and sharing my passion for that it began to rub off on all of them. And really looking and seeing that each time I spread that knowledge, it continued to grow and grow. And then all of a sudden I would see other providers providing the care that we should be to this patient population the way I have spoke and practiced and preached along the way. So really being persistent keeps things going and keeps that, my team. I mean, I went from one provider, just me, to 7 providers, which is pretty huge to grow or to even be able to gain more providers within a big healthcare system. It's very, very hard to get approval for that. The next step, or the next slide, is being receptive, because that's the one thing, again, is not everybody shares your passion. Not everybody wants to take care of the older population, but being open-minded about that. But also along the way, there may be ideas or plans that I have done that there were better ways to do it. So being open-minded by other partners within the group. And again, this was not something I did alone. If I did not have the support and for what I, along the way within this system, I would have never have been able to start this program and grow this program. But really taking all ideas and knowing that sometimes when you have a plan or a ladder that you're going to take, that may not always be the path that you go, because as you're learning along the way, that may change. So it's really, I always said it, and along the way too, being receptive is not necessarily about what you say, but how you say it, is what one of the providers said to me a long time ago in my career, and it's always stuck with me. Because if you want something done, and sometimes those topics are hard to approach, you can really say it in a kind way and it can be very effective. So being open-minded and aware of how you're saying things is really important. All right, the next slide. And then being reflective. So, sometimes it feels like you're not making progress when you're working on a program, on being a leader, trying to make change, but really just step back and reflect and then restart. And maybe it's a different path you have to go, but be willing to take a different path, but learn from your failures. For example, I learned from a lot of my I could have done this a little bit better when I was first starting the program. So as I started training new providers, I trained them to not make those same failures or mistakes that I did to make things go more smoothly in the front. And I would say none of the mistakes were huge. It was just a way to be more effective or efficient is what I learned along the way. All right, next slide. So over the program, I started it back in 2020. I was the lone nurse practitioner as a new provider for the first couple years, caring for patients 65 years and older who were arrived to the hospital with injuries. I did a specialized geriatric assessment, medication management, managed all their comorbidities, decreased other consults that needed to be done, helped to decrease hospital length of stay, helped with appropriate discharge to locations at whether they can't go home anymore, so helping them find home, new placement, but also really focus on aligning wishes. And for example, I had a patient who was elder with a head bleed with advanced illness and dementia, and the plan was going to the operating room, and the family said they did not want that. So really helping them walk through that process, aligning wishes of what the patients don't want or do want to improve outcomes. And with that, like I said, I went from one provider to 7 and started with only taking care of a small subset population of the traumatic injured geriatric patients to even going outside the trauma population to the ortho population, the burn population, and also advancing to the general surgery population in the future to even some other smaller hospitals across the system. So me starting as myself really had a big idea in a big place, but a small me, but I was able to do it. And it's a program that is really trying to be replicated across other hospitals in the state and country at this time. All right, next slide. So really in leadership, along the way, it's always important to continue to gain knowledge, read more, read your surrounding environment and those who are involved, but use your skills to the max and influence the pack. I became that person that everyone came to with questions related to the geriatric population. There was not one single geriatric provider within this healthcare system that worked in the inpatient setting. I was the only one, and now we're growing that program. Really reached my goal to get to that success of knowing I care for taking care of this population so much. I want better care and outcomes and specialty care for them that they need, and recognize that and push forward to reaching that goal. Next slide, please. So a summary, as you're working in the leadership world, don't accept status quo. The one thing I've always done is if a question or I have a gut instinct about something, I'm asking questions. If somebody doesn't know, I'm asking someone else until I can get the answer. And part of that is being persistent, receptive, and reflective along the way, and really never giving up. So as a leader, we're always learning with our pupils, with our peers. So continue to learn, be open-minded, and change happens ahead that can be very successful. So do what's right, never change who you are, be transparent, and again, just don't accept status quo, but follow that passion, that dream. And I know when I first started with pen and paper, the path I had in the beginning was not the same path it took to get to where I am, but I got there because I was able to be persistent, receptive, and reflective. Next slide. And that's it. If anybody has any questions, there's my email. And I'm happy to help in any way that I can.
I have some questions. It's Kelly.
Yes.
So you talked early on about you came up with a number of different ideas and you had to kind of chew on them and work through them and evaluate whether or not they were the right fit for right now or the right fit for where you were. What kinds of questions, or how do you evaluate whether something's a good idea. And I'll give you a little bit of context for my Master of Arts in Leadership students. They're in a class right now where they're learning about the creative problem solving process. And you go from having all of these great ideas to then creating criteria and then figuring out which is going to work. So can you tell us what does that look and feel like out in the world in a healthcare setting?
Yeah, and that's a really good question. And that brings me back to I remember being at the big table with all the key stakeholders in the very beginning. And it does, because my big idea was I want to take care of every single geriatric trauma patient. But part of that was I had this big idea to touch all of them, but I'm the only nurse practitioner. And I knew I didn't have the bandwidth to touch every single one of them. So I knew I had to start a little bit smaller and step back. And so instead, what I did was set really tight criteria. Like patients had to come in with a ground level fall. So at first, I didn't see those older patients who were in motor vehicle crashes. And they had to have certain injuries like rib fractures, a head bleed, a hip fracture, or a pelvis fracture. So it was really defined criteria. But as the days went on, I got more fluid and efficient on caring for them. I was able to expand the criteria to also those with additional injuries, say if they had a splenic injury or things like that, to motor vehicle crashes, and then expanding to even the burn population. So really starting small and going big to make this program more successful. So I knew where I needed to do more work to provide that improvement in my process, and ultimately grow successfully in a timely manner.
Awesome. Thank you for sharing that description of how you did it. I have another question, and that question is, so you're communicating up and down the chain and around an entire system. Did you have specific strategies for communicating with different levels of people? We've talked about how there's just different ways. Can you kind of talk about, like, did you have a plan, or was it just you find one person and have one-on-one conversations, or how did you get people excited about it in terms of your communication strategy?
Yeah, in the beginning, as I was working on developing this program, I did a lot of presentations and education just to get them to understand that the geriatric population is different, because a lot of people didn't always think that. But I also knew I had to speak differently to, physicians versus nurses versus, occupational therapy. So really trying to, because if I went in and talked to the social worker about all of this patient's medications and what I wanted to change, that wasn't going to work because that wasn't their expertise. So I really had to make sure I was talking the right healthcare lingo to the right person along the way to get them buy-in. But also, one of the big things I did when I first started was try to find people in each discipline, whether it's like physical therapy, nutrition, nursing, surgeons, tap into them to see, did any of them have passion for the geriatric population first? Because if they said yes or slightly talked in that lingo, I pulled them right in and eventually got them all the way in. So that's kind of what I did. And there were times too where I had pushback where people were just trying to get through, this rotation on trauma, or, not necessarily happy about taking care of the older adult population, because I get it. It's not everybody's passion, but really just being kind about that and understanding about that. And then really having good conversations with them that actually, in the healthcare world, we always want to learn more and educate. So had educational topics on it that really help broaden their thoughts about it. And yeah, I've had lots of them who actually I never thought would pull through, who have actually been really excited and happy about taking care of this population now.
That's super interesting. One of our earlier speakers had said, she was talking about the people who are super enthusiastic at first, they tend to burn out really quickly. And then you've got the naysayers that you just kind of want to let them be for a while. But it's those people that once you educate them and they have that aha, they all of a sudden become champions. And it sounds like that might happen with you as well.
Yes, it definitely has. And it's been pretty neat to see, because it has. It's all over now and it's well known. So that's what's so great about it.
Awesome. I'm going to just give anyone else a chance. I have one more question though. And my question is about the geriatric population. Is it hard to work with them knowing that they're more fragile, they're on a certain kind of trajectory being up there. What do you do to stay well emotionally? Are there things that you do to just make sure that you're the strongest and best advocate for them?
Yeah, because that's a really good question too, because it is hard sometimes. Because sometimes we are, because they're older, they're more frail with lots of illnesses. Um, it sometimes is end of life for them, and you've gotten attached to them and had that continuity of care. So that can be a very big challenge. But the one thing that I always have as a healthcare provider has always looked back to say, as long as I gave the best care I possibly could and I'm providing the care that they want, I do a lot of self-reflection in that way and knowing that I did my best and I developed this relationship with them knowing they're happy about it and okay with this. That's where I feel good. I mean, there are times where it's hard because things are sudden, but fortunately with the geriatric population, we, as a geriatric team, we know that the outcomes can be poor pretty early on. So we discuss those early, and those conversations can be so hard. But I've had a lot of great team members that I've been able to reflect with too if we've had hard cases. But also, again, outside of all this, we have to make sure we're continuing our hobbies. I was an avid runner, so I'd put my music in and run to really just get away from all of this and let my thoughts clear. And because I did allow this process to be my whole life from when I woke up to when I went to bed, and we have to be careful of that and limit ourselves, and have good time management. And that's something I learned along the way too. Is I had to learn that. But definitely making time for yourself and stepping away from it is important because that will help you regenerate and also. Oh no, did it go? Oh, sorry. Are you still there? For some reason the screen just went out.
Yeah,
You still hear me?
yeah,
Oh, okay.
yeah. I'm not sure.
Allows you to regenerate is what we call it too. So rejuvenate.
Sure, sure. So I'm looking to see if there are any more questions, and it doesn't appear that there's anyone that has questions, but I will tell everyone that we have a great opportunity with this colloquium to continue the conversation through the online leadership learning community that we have on Canvas. For each one of our presentations, we have a discussion forum where you can, if you come up with questions or if you want to talk more with Kathy about some of the ideas, you are welcome to go into that discussion forum. It's an LDR 900, and everyone is able to get into that class without registering or signing up or anything. You just go in there and go into the discussion forum. I'll be checking it a couple times a week. And if you would like me to get a message to Kathy and get you connected, I'd be happy to do that, Kathy, if that's okay with you.
Absolutely.
Okay, awesome. So yeah, so if there are things you want to talk about, let's continue that conversation. Kathy, this has been a fantastic conversation. A lot of learning about, even if we're not even anywhere close to healthcare, the process of innovation and the process of leading innovation is pretty standard. And you've done an amazing job of using that process to create amazing levels of hope for families and caring for the most important population. That's where we all come from. And
Yeah,
and so thank you for doing that for all of our families, our older folks.
absolutely. My pleasure.
Well, have a
Thank you
great
for
night,
having me.
and we look forward to talking with you again.
Yes, thank you very much.
Thank you. Take care.
You too.